Good evening. As an ICU nurse, I've witnessed the good, the bad, and the ugly deaths. I'm here today to talk to you about a medical specialty that may help change some of those bad and ugly deaths to good deaths. The specialty I'm speaking of is palliative care. Palliative care is what most people may seem or may think of as modern-day euthanasia. Today, I will provide you the facts about palliative care, define what it is and what the objectives of palliative care are, as well as clarify some of the myths surrounding palliative care. And who knows, by the end of this discussion, you may be able to join me on my journey and helping get people on board of creating an experience of death that's not bad or ugly. First of all, let's start with the definition of palliative care. The World Health Organization defines palliative care as a total care of patient who has been diagnosed with a terminally ill disease and no longer has hope for curative measures. Simply put, it's an active approach or system management and family support to a patient who is near death. The objectives of palliative care include the affirmation of death in regard as a normal process, and to offer support to the patient and the family members in their time of needs. Also to integrate psychological and social aspects into the care, and it extends well beyond the period of death. It helps the family to cope. Some myths surrounding palliative care include the fact that if the patient accepts palliative care, the doctor has given up. When palliative care is proposed, it just says that the doctor is willing to accept alternative measures. The team has recognized that your disease cannot be cured, and they want to offer you a more comfortable remaining lifetime. So end-of-life care can be a little bit more enjoyable and a lot less painful. That's where palliative care comes in. Another myth surrounding palliative care is the fact that palliative care means no more treatment. Treatment and therapies in palliative care can continue. The goals just are different. For example, a patient with a tumor can receive radiation therapy, not to cure the cancer, but to take away the pain or to improve the breathing capacity of that patient so that they can have a more comfortable end of life. Another myth surrounding palliative care is that palliative care is for old people. Very untrue. We have some babies that are born with terminally ill diseases, and it's very hard for the families to cope with that. So physicians and healthcare providers place that family on a consult with a palliative care team who takes into consideration the whole picture and gives the family time to deal with what has happened, and children alike who suffer from cancers and different things like that are also on palliative care. So it's not just for old people. Another myth surrounding palliative care says that if I get palliative care, I have to be in the hospital. Palliative care services are offered on an outpatient basis. It just depends on the type of resources that you have. You can also receive palliative care at home. And finally, another myth surrounding palliative care is that I have no control over my care if I agree to it. Palliative care is a specialty in medicine, just like cardiology and neurology. You meet with those specialists to get input or advice on what you should do to treat the problems that you're having. Palliative care is just that way. It's just that we're dealing with end-of-life choices and quality of life at the end of life. It is a specialty. We don't take over, we work as a team. You can learn more about palliative care if you visit the Center to Advance Palliative Care website. Also, to find out how to pay for palliative care, you can visit the Medicare or Medicaid.gov website. Most insurances do pay for this treatment. In conclusion, education by nurses to family members, doctors, and patients alike on the specialty of palliative care can help change some of those bad and ugly deaths to great experiences. It doesn't all have to be sad just because the end of life is near. That concludes my speech here today. I hope that I've enlightened you on the subject, and hopefully you can come aboard and help educate other people on the new specialty. Let's change this end of life experience to an excellent end of life experience. Thank you.